Support comes from Thomas Nelson Community College, the first choice to make college possible. As education costs rise, Thomas Nelson's affordable tuition, financial aid, and scholarships make college accessible to everyone. More at tncc.edu.
Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.
Hello, everyone. I'm Barbara Ham Lee. The Pfizer vaccine has full FDA approval as an effective vaccine to protect you against COVID-19. Governmental health agencies say those of us who are fully vaccinated against the COVID-19 virus need to get a booster shot in order to stay protected. Governor Rick Northam has mandated mask wearing in all schools. What should you do to prepare your kids for returning to the classroom? The Delta variant is still spreading rapidly, and with all of this, we are still trying to convince millions of people, including African Americans, to get their first shot. Lots to unpack with cardiologist and Director of Health Equity for Centera, Dr. Keith Newby. Stay tuned. Another View will be right back after this national and local news from NPR and WHRV News.
Discussing today's topics from an African American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Ham Lee. Grab a pencil, because I got 4 things to tell you about that I think you will be very interested in that is going on in our community. First, this Saturday, August the 28th, the Community Connect is happening in the city of Norfolk. Now, this is being hosted by Carlos Clanton, who is a Ward 3 member and the vice chair of Norfolk City School Board, Public Schools Board, and the Honorable Mamie Johnson, who is also a Ward 3 member, and she's on the Norfolk City Council. Now, the day is going to be incredible. Children and family fun, including back-to-school supplies, distribution, mentoring programs, arts and crafts, face painting, everything for the kids to do. But it also will include information on education, employment, housing, health, and civic engagement, including COVID-19 vaccines, which will be given out during this event. So pay attention to that. Health screenings, mental health information, job placement, anything that you can think of that you may need, they are going to be handling it on this coming Saturday. Now, where it's going to be held is at the plot next to the Richard Bowling Elementary School, and that is at 2600 East Princess Anne Road in Norfolk. And it is, again, hosted by Mamie Johnson and Carlos Clanton, and powered by the GWC Brown Legacy Education Fund, Alpha Phi Alpha Fraternity Incorporated, the Alpha Pi Lambda Chapter, Stop Inc., and the City of Norfolk. It's from noon until 5 o'clock. It's free. Come on out and have a great time. If you're looking for another place to get your vaccine, the Centera Vaccine Clinic, this is Hampton Roads Transit, partnering with Centera and Second Calvary Baptist Church. They're going to hold another clinic at the Downtown Norfolk Transit Center. And it's on this coming Tuesday, August the 31st, from 3 until 5 p.m. Come on in, roll up your sleeve, get your vaccine, save a life, including your own. And then on September 1st, from noon until 3:30 p.m., there will be another COVID-19 vaccine clinic. It is free and open to the public, and it is going to be at Purpose Park, which is at 801 Church Street in Norfolk. Everyone is invited. If you bring your child, remember your child must be 12 years old or older, and a parent or guardian must accompany minors. But they will be doing a healing circle. They'll have the health department there to answer your questions, and giving out vaccines, and also a school giveaway. And then finally, Sleeping Cat Studio is going to be presenting at MacArthur Mall on September 3rd, 4th, and 5th a play called The Ribbon Mill. And this is to benefit Hope House Foundation. Now, Hope House Foundation's mission is social justice for people with disabilities, and your tickets will go to support that organization. It's a 2-act drama written by Mr. Jim Exposito. And it sounds like it's going to be a fabulous event, and it's the first time that an actual play is happening inside of MacArthur Mall. So you don't want to miss that. That is September 3rd, 4th, and 5th. So there you go. Lots of things happening in our area today. And also there's so much going on with the coronavirus pandemic. The FDA approval of one of the vaccines, first, second, and now third shots, kids in schools and masks, the Delta variant, and cardiologist Dr. Keith Newby, who also serves as the Director of Health Equity for Centera. He's here with us, hopefully, to answer a bunch of questions. How are you, Dr. Newby?
I am doing well. How are you?
I'm doing great. Let me put the phone number out there before you and I start talking. 440-2665 or 1-800-940-2240. Those are the numbers to call to ask your questions about the Delta variant, about wearing masks, about anything you want to know about COVID-19. 440-2665 or 1-800-940-2240. So, Keith, the FDA fully approved Pfizer this week. What does this actually mean to us, and why does it matter?
Well, it only really matters to those who made it into a big deal. I knew it was going to get approved anyway because it met all the criteria. There's just the things that I try to inform people is there are processes that have to go through for full authorization from the FDA. The main part is safety and efficacy, and that part was already done. So now it's the red tape part they had to get through, and that's what dragged it out a little bit. So, I knew it was going to get approved, just like I know Moderna is going to get approved. It's just a matter of when. You look at timelines, I think it was like late November was when the FDA gave emergency authorization use for the Pfizer vaccine, and then Moderna came a month later. So I expect probably by the end of, probably middle to end of next month, Moderna probably will be fully FDA approved at that time as well. I don't know all that red tape stuff that they have to go through, but, that was really what it was. Now, for some people who kept using that as their excuse why they wouldn't get vaccinated, now they have no more excuses, or they're going to come up with a new one now because they can't use that one anymore. So the thing is, we just have to for those people who just needed that comfort, I think that's what it means, is those people have that now. They have that comfort that they can say, listen, it's fully FDA approved. Go ahead and get it.
So have you heard of people saying now, you know what, now I'm going to do it? Do you think it actually is working as an encouragement to get people?
I think for some, but there are a lot of people, they would just use that as a reason not to get it. And they're going to come up with a new reason now. Because it's just the unfortunate reality is there's so much misinformation out here, and that's the part that breaks my heart. Is the misinformation part. I live COVID-19 every day. And I tell people that come to me with some nonsense about, why they don't want to get it. And I'm like, listen, that's your choice. That's what makes it great. But just understand what might get affected as a result of you not doing it. One of the Centera guys I work with, we've been putting a lot of, trying to get a lot of videos and infomercials out, about the vaccine. I have a host of people, patients of mine who have had come in who've had COVID-19 and regretted the fact that they didn't get vaccinated, who, said, listen, if I had to do it over again, I would have gotten it, and this is the reason why. And I didn't give them a script to read. This is their own personal experience, of the aftermath of COVID-19, because you may get through it, but there are a lot of people that have long-term symptoms as a result of having the infection. Some people do great. They get it, and some never even knew they had it, and that's fine. But you're rolling the dice, because that's the thing I'm trying to tell people. At least with the vaccine, characteristically the least amount of symptoms you're going to have and the most you're going to have. It's going to be within this range. The problem is when you have COVID-19 infection, you're rolling the dice. You don't know what you're going to get.
Yeah.
And for me personally, I'm not willing to take that risk. I'm not trying to risk myself nor my family to sit there and say, I'm just going to be so selfish that I'm not worried about anybody else that I may affect. I'm just going to worry about me. I can't do that.
So I'm really surprised, and this is something that's baffled me the whole time through this issue. Now, this week, most of the Hampton Roads hospital systems have now said they will require employees to be vaccinated. People who are working on COVID wards and seeing what happens to people, why would a healthcare worker be hesitant? I honestly, it boggles my mind to think.
Well, remember, there's still people too, and I'll tell you, every now and then I run into a doctor that doesn't want it, but the vast majority of us who know the data, we don't have issues, but doctors are people too, and healthcare workers, everybody has their particular feelings, and I can't comment to that. I just know personally, once I've seen what COVID did to people, I've had 60-plus now patients die of COVID-19, that I know about. And it broke my heart last Monday. A 49-year-old woman came in Friday night with COVID-19. They called me because she had a fluid collection around her heart that we know was a direct reflection. People were worried about like the Johnson & Johnson vaccine and thinking about it as causing some heart issues. Well, COVID-19 can cause heart issues. And this lady refused to be vaccinated prior to and came in on a Friday night and died Monday night from COVID-19. No other medical problems other than she was a little overweight, and that was it. Dead. Wow. And that kind of stuff, see, for me, and I try to get people to understand, for me as a physician, I went into this really with an altruistic viewpoint of helping people and trying my best to save lives. That's what I went in this business for, and I do it to the best of my ability. But I'm not going to let any personal bias or any other issue invade that recommendation I have to get people to do what the data suggests we should do. I'm going to let that guide me. I'm a Duke guy. At Duke, we were data-driven people, and the data says this is what we should recommend based on what we have. And there's just no reason for us to duck and dodge this issue. I mean, you can, but this is what comes out of it.
This is what happens. So I know, Keith, that you're also involved with Norfolk State, and yesterday article came out in the Virginian Pilot that Norfolk State is offering $500 to students and $1,000 to faculty and staff for being vaccinated. So, do we need to, is it that?
Well, I tell you, every time I get heartburn, every time I hear these, I understand the premise as to why, but you're kind of like, man, I guess, some of us who have we've taken, any inherent risk that we think may be there getting a vaccine to do what we know is right, and I'm like, so we're going to reward the scragglers, and I don't know. I have mixed reviews on that, mixed feelings, I should say. Should you reward people for doing what their civic duty is protect those around them? I don't know, especially now that it's been FDA approved, there's no reason now to hold back. This is not, again, we're not talking about the flu. We're not talking about that. And that's where, I'm trying to get people to understand this is different. This is not a regular flu bug. And I hear all the crazy, this was created and man-made. Listen, I don't know that, and they don't know that either. But the bottom line is we got a problem. Regardless of where it came from, regardless of was it created or did it spontaneously occur? It really, in the end, doesn't matter.
Because
we
here.
got a problem. Yeah, it's here. We got a problem we have to address. I don't care where it came from. I don't want my family dying. I've had two first cousins die of COVID-19, a husband and wife, 2 days apart in March. They were not vaccinated, and they died. So what do I care about anything else other than trying to save lives?
Yeah.
I don't want to see any more wasted time with people.
So let's talk about the booster shots.
Yes.
Because people, from my understanding, and you can correct me if I am wrong, this is not unusual that we would need booster shots, that we really kind of moved up the timeline to get everybody fully vaccinated to begin with. Is that correct?
Yeah. Yes. Yeah. The booster shots, like anything else, if you're not a lot of times what happens and what people just need to understand is how this stuff works.
Okay.
You get this messenger RNA. It sends a message. It's only, if you really look at it, the actual vaccine itself only hangs around for a very short period of time. We're probably talking hours that it's in the system, but the effect can last, a couple of weeks. But the body breaks the vaccine down, and that's how it's not around very long. But it's sending a message to tell you your muscle cells that create the spike protein found on the coronavirus molecule. There's no DNA in there. That's what I'm trying to get people to understand. They always talk about it's going to affect my DNA. Half the time when people say that to me, I say, well, what is DNA? And they can't even answer that. I said, so if you at least do your background research first before you make conclusions. But anyway, So you get this spike protein that's temporarily on the surface of your muscle cells around where the vaccine was given. Your body says, okay, I know that's not right. That's a foreign situation, so I need to attack that one area, which is those spike proteins, which are found on the coronavirus molecule. So your body is now ready. It says, okay, the immune response kicks in, and it's preparing itself for another battle if you were to get the actual infection. Okay. And I tell people, look at it like if you're going to get in a fight with Mike Tyson, you're not going to go in the cold. You're going to get prepared. You're going to get a sparring partner that's going to help you get ready. Look at it also like if you have, say, you're going to battle and you're going to fight an army with 2,000 people, where if it's just you and another dude, and fighting 2,000 people, your relative success rates are going to be low that you're going to win.
Right.
Now, the vaccine is like building that army. So now you're going to have 2,000 or more people. So when this 2,000 army comes to you, you've got more people to fight it. Gotcha. So that's what this is all about.
So we get the vaccine, the third shot. Will the side effects be the same as what happened to some people in their first and second shots?
It may be, but it may not be. That's the thing. That a lot of stuff is unpredictable. But what I can tell you is this: because there are people that have gotten it. The Israelis, they're doing it now. And they haven't reported anything with a problem with the third shot. So I can't comment about what the issues may or may not be. But like any other shot, my expectation is if you didn't have much with the first two, you probably won't have much from the third. I can't say that 100% for sure until I've had my third one. But trust me, right. I'm gonna be the front of the line when they're ready to do it.
I actually reached out to you when I heard that the third shot was coming. They said when? When?
Like I told you, I said right after I get mine.
Absolutely.
But the thing is, but I think all this essentially, just look at it like that army. After say, if you got 2,000 person army and you're not fighting for a year, a lot of people gonna get stale and they're gonna gain weight. They're gonna be trifling, sitting around not doing anything. They're not gonna be ready for a fight. Yeah. So look at the boosters like you're just getting people back in shape, ready for it. And we know this can happen.
And I guess the other thing that's kind of baffling is why this seems to be to some people so foreign when the flu shot you get every single year.
I know.
It's the same thing, isn't it?
Listen, Barbara, they just made it. We have trained our minds to look at this as the enemy. Just like all the falsehoods on TV. And I tell people all the time, I don't look at, when I want accurate news, I'm not looking at Fox, CNN, NBC, Newsmax. I'm not looking at those places. I'm going to places like, WHRO, a public radio and public TV. I go to things like the Hopkins website. Hopkins is number one in public health in the United States. Chapel Hill is number two. So I look at sites like that. I get my information from places that have no vested interest in saying anything. It's not my opinion. It's not, my viewpoint because I'm a Republican or a Democrat. It's what the real facts are. And I tell people, go to reputable sites where they know what they're talking about. There's no hidden agendas involved. And look there and try to get your information from places like that. That's going to give you that non-biased, kind of accurate information that you can at least have some assurity that it's going to be factual.
Yeah, 440-2665 or 1-800-940-2240 are the numbers to call. What questions do you have? Have you not been vaccinated yet? Are you still hesitant even though the FDA has fully approved the Pfizer vaccine? What will it take to convince you? Give us a call. Let's talk about it. 440-2665 or 1-800-940-2240. So, Dr. Newby, we watched many school divisions prior to Governor Northam putting a mandate for masking for all schools in place, say that they were not going to do that. The Virginia Beach School Board meeting was 6 hours, and it was not pleasant. People are still fighting, this whole idea of our children. An article came out, CNN this morning, that the COVID-19 cases are surging among children because they aren't eligible for the vaccine yet. Do you recommend people get their kids vaccinated if they can? If they can't, do they need to be wearing those masks?
Yes to both. My 16-year-old got her shot a few months ago, right when she turned 16. Because at the time that was when they could get it. My older two children, well, they're not children anymore, where they're 25 and 31. Got it right around the time you got yours.
Mm-hmm.
I guess this is the thing, and I try to get people to take themselves outside of themselves and look at the greater good in terms of, what happens as a result. When last year, about last year this time, we were surging from June through probably I think it was like September, October.
Mm-hmm.
It was like surging, and it kind of died down a hair, and then came December, it started surging back up again in terms of the number of cases. Once the vaccine came out, because you remember December, you couldn't hardly get anything.
Right.
It wasn't until January, that we started running into an issue of, getting access to vaccines. It came end of February, early March, I started seeing a decline in the number of people coming into the hospital with COVID-19 infection. Came, I think it was April. I didn't hardly have anyone. I mean, I was having an average of probably 12 people with COVID-19 infection on my personal service in the hospital out of about 20-some people I would have at any one time. It was at least half. It went down to 0. The whole month of May, I did not have one case in the hospital. End of April to May. And then the end of May, I think I had one. June, I started to have a few more. And it's kind of hovering right now. Yeah, you start to see a little bit of a bump up. Because I think we have a lot of people have gotten their vaccines, it's not as bad as it could have been had they not. But we were surging last year this time. Now it's other places that are surging. But I get worried about the kids. I mean, again, they had this lady that just died on me last Monday. That stuff breaks your heart. You think about a little kid potentially dying? Because you want to be hard-headed. But going on really no factual information on it. To a certain degree, you have to ask yourself, what's the gain for people to lie, about this vaccine?
Yeah.
What is the gain? That's what I'm trying to, the world is not a conspiracy theory. Every aspect of our life is not a conspiracy theory. And we have to try to get to a point where we ask ourselves, are we trying to save lives or not? And I tell you, if something happened to my kids behind COVID because I chose to not let them get a shot, at least if they got one and something happened, at least I would have felt I've done everything I could to protect them.
Yeah.
And again, I know they have the parents are not, I'm not knocking anybody, for what they do. That's their choice. But just try to understand how your choice may affect them negatively. And just keep that in the back of your mind.
I tell you, my 11-year-old granddaughter spent 3 weeks with us. And when she went back to Baltimore on Saturday, she had to get tested immediately because school started for her yesterday. And I was a nervous wreck until that test came back negative. Honestly, because I would have felt horrible. Everywhere we went, we were masked. We made sure we stayed away from crowds. I did not do any events or any of my work with my company in person, because I truly was that nervous about this Delta variant and it being so easily transmitted. And
That's what I'm trying to tell people.
Yeah.
I mean, I'm with you 100%. I mean, that's what I'm trying to tell people. You just don't know. And I'm gonna tell you, inherently, I mean, I don't get scared easily. I really don't. But this stuff is nerve-wracking because it's the unpredictableness of this situation and what it can do and what it can't do, and you really just don't know until you get it and see what happens. And I'm gonna tell you, that's why I don't gamble. Listen, because they say there's a sucker born every day. If a gambling casino sees me coming, also there's our pigeon right there. That's why I do not gamble, because I lose. I have never won anything in my life.
And you're not going to start with the virus.
I'm not going to start with the virus.
If you're just joining us, we're talking about the latest with the coronavirus pandemic with cardiologist Dr. Keith Newby, who also serves as the Director of Health Equity with Centera. 440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. What questions do you have about getting your shots? Let's go to Sarah on the Eastern Shore. Hi, Sarah. You're on the air.
Hello.
Hi.
Hi. I am calling to respond to some comments that I heard on the roundtable 2 weeks ago, and also that I've heard from other people elsewhere, to the effect that what each person does in deciding about getting vaccinated is his or her own decision with no implications to anybody else. And an analogy that I've heard that was helpful to me in trying to explain that is to say, if you want to get drunk and stay at home, that's your business. If you want to get drunk and stay and get behind the wheel of a car, that's the community's business, because if you crash that car, you're going to affect other people beyond yourself. Mm-hmm. If you get the virus and you infect somebody else, that's an effect to the community and not just to you and your own family.
Okay, Sarah, thanks so much for the call. And Dr. Newby, do you agree with her?
100%. Yeah, 100,000%. And that's why I try to tell people. I say, what you do does not just affect you. And again, if you decide that you're going to stay at home, you're never going to go out, grocery shopping. If somebody brings you groceries, you're going to have them delivered inside your garage, and they're going to bust out, and you're going to go and get them later on. And you live your life that way, then fine. I mean, but just understand what you do. If you go out and give it, say you're an asymptomatic carrier, then you go give it to your mother. And if she gets sick and dies, would you be okay with that? I wouldn't. I wouldn't at all. And I would feel heartbroken that I took matters in my own hands and just didn't care what I did and how it affected somebody else. So if you stay at home, I got patients that said that to me. They come in the room, they won't take the vaccine. They say, well, I never go anywhere. So I'm looking at them. I said, you're here with me now. So by definition, that's not true. This is what I got to deal with on an everyday basis. I'm like, you're not. If you were home calling here, okay, I'm with you. But you came out.
Gotcha.
If you came here, I guarantee you're going somewhere else.
Yeah.
So you're not just affecting yourself.
Our phone lines are lit up, so let's take a couple of calls. Yep. Susan is calling us from Virginia Beach. Hi, Susan. You're on the air.
Oh, hi.
Hi.
Hi. I'm just calling a question about the booster shot. Mm-hmm. Is the formula for the booster shot different from the first two shots that I got with Pfizer?
No. Same dose.
No.
Same dosing.
Okay.
Yeah, same dosing. Yeah, it's going to be, it just give me like an extra oomph to your immune response. So it's the exact same amount, exact same everything.
Okay. Thank you, Susan, for the call. We appreciate it.
Okay.
Thank you. Let's talk to Gwen in Hampton. Hi, Gwen. You're on the air.
Hello. Good morning to both of you.
Hi.
Hi. I am an elder, and I have taken everything that's offered as soon as I could get it. I've had both shots, and I will be online for the booster when it's available. As an elder, however, I am also supposed to be taking other kinds of shots. For example, the shingles.
Mm-hmm.
So one of my questions is how does one manage if you need to do other shots and make sure that it's not in conflict with the booster? First question. And my second question is, should we be changing our lifestyle again? Should we be more concerned with mask wearing, social distancing, sanitizing surfaces? I was invited out to a restaurant to eat, and I opted not to do that because, again, I'm not sure what I should be doing to protect myself at my stage of life. I'm 88. So any hints that you could give us with me and others would be helpful.
Those are two great questions, Gwen. Thank you so much for your call. Keith, you want to take those?
Yeah, what was her first question?
The first question was, how does she manage her booster shot with also getting shingles and so forth?
Yeah, so that part, what we have to do when we're giving shots here, one of the questions we ask is, have you had any vaccines in the last 2 weeks? So that's part of the issue is you want to give a little time distance between because your immune response is already kicking on one thing. So we normally tell, and I would tell you this, I would get when you know for sure the vaccine is going to be available. We're still kind of waiting on final recommendations from the CDC. I know the Biden administration commented they're encouraging it already. Like now, when your time is up, they want you to wait 8 months, from your second shot, which for me was going to be September. So I think that's what they're probably waiting on. I'm sure they're probably going to make that recommendation. But I would say if you have other shots you want to get, I would probably go ahead and get them now. And then that way, by the time, you need to get to your booster shot, you have already been at least 2 weeks out from any prior vaccinations. Now, you can wait and get the booster shot, but I will wait probably 2 to 3 weeks after the booster shot before I got another vaccine. Okay. So I think however you time it, just time it either before or after by a couple of weeks. That's that one. And to answer the second question, personally, this Delta variant is more transmissible than the original Alpha variant, which we had at first. So I would actually say, yes, I think you should have this, protect yourself as best you can. And I'll be honest with you, I haven't been anywhere, and other than to the hospital and home. I have not been, I haven't gone to any events. And I love all my people. I love them to death. I love them on Zoom better. So, right now, I'm just not there yet. And the reason being is there's still too much uncertainty about this Delta variant and how it's going to impact. So to me, for right now, until we have more information, I would say protect yourself just like you did initially. I'm social distancing. I feel a little bit better because I've been vaccinated, but I have not dropped my guard. I still, when I go anywhere, I still wear the mask. And I go to the store. I did an event for Centera de Marriott. Trust me, I was definitely distancing myself from people. Yeah. I went in, did my bit, and I got it back out. Because again, you just don't know. Absolutely. And you don't know the people around you who's actually been vaccinated and who has not. So you don't want to take too many risks in that regard.
Okay, thank you, Gwen, for the call. Harold joins us from Newport News. Hi, Harold. You're on the air.
Hello, how are you?
Okay, how are you?
Well, my question is, for me, I was considered essential personnel since this whole thing started. And, before vaccines was available, I caught COVID. Fought it off, survived. Since I've been working these last 18 months, about 9 of my coworkers have caught COVID. No one has died yet. My daughter, who was in private school, because they didn't shut down, she got COVID. She survived. And my question is, from what they say about the vaccine, it only stops severe COVID. I've already had COVID, didn't get severe COVID, barely even knew I had it, besides the fact that we got tested because someone popped positive. So what's the point of me getting it if I know I'm not going to get severe COVID?
Okay, well, thank you, Harold.
Firstly, you don't know you're not going to get severe COVID. Just because you had COVID once doesn't mean the second one wouldn't be severe. I told you, you're rolling the dice. Secondly, your level of immunity, they say, wanes quicker when people have had their natural immunity wanes quicker with COVID infection than it does with the vaccine. They were saying 3 months you're starting to wane your infection, your antibody levels already. So the way that if you look at any of this current data in terms of explanations, they're saying that when you get the COVID infection and that natural immunity is one part of the immunity, but the vaccine actually boosts your total immunity up, significantly higher. So you're actually protecting yourself more. Now, the one thing I want to make sure that everybody's clear, you can still catch COVID-19 if you've been vaccinated. There's no question that you can catch it. Mm-hmm. But don't think that just because they say, that it means that that everybody's assured that they would potentially get it no matter if they got vaccinated or not. That's not the case. They're saying that if you look at the data, it said 94% will protect you from getting infected, but 100% was for severe disease and death in the original study. But that was with the alpha variant. Now we're talking about something else. We have a more transmissible part. Is the numbers identical with the delta versus the alpha is the question. And again, the question that you have to ask yourself, Harold, is do you want to roll the dice with your life? And for me, everything is about risk-benefit ratio. I look at it in my life, okay, if I want to walk out on Brownton Avenue at 5 o'clock with 100 cars about to run me over versus walking out at 5 a.m. across the street, if I'm going to go blindfold across the street, I know I have a lesser chance of getting hit at 5 a.m. than I do at, say, 3 p.m. Mm-hmm. So, it's all about risk-benefit. I look at it as less likely getting the shot. And think about it also like this. Think about the people that who've been vaccinated. Are they still living? Because if they are, then that means they made it through the shot. So then the question you have to ask yourself is, why are you so anti-vaccine? That's the part I want people to really start thinking about is why is it? Why would you take the risk on getting the infection versus getting the shot? Well, we know the risks of the shot, but we don't know the risk of if you get COVID-19. You were very fortunate and blessed that you got through it. Everybody's not like that. Prime example is that young lady I told you about who did not get the vaccine and died 3 days after she came into the hospital.
Yeah. Thank you for the call, Harold. We appreciate that. So, Dr. Newby, you really have put yourself out there. You believe in the science, as you say, and that's what you're following, and you're trying to encourage people to pay attention and do their own research also. But get the shot if they need to. And unfortunately, you sent me a letter that you received recently where it was not a positive letter, and people were basically saying that you are passing on bad information. And I wonder if you want to respond to the people who did not sign their name.
Yeah, well, the one thing I will say is this. I looked at it a couple of different ways. Firstly, I can tell them, I guarantee you, my information is based on science that's available from reputable sources. Now, some jackleg person that came and made up something as they went along, because then I've seen it from different places. I've looked at the original data, I looked at follow-up data, I looked at the different institutions that have studied COVID-19. All my information is based on that. I have no vested interest, and I have no financial parts of Pfizer, Moderna, Johnson & Johnson, none of those things. So I have nothing to hide as it relates to my motivations, but only to keep people alive. So that's that issue. Secondly, in my mind, I'm like, I'm out there, I put my name out there. I put my reputation out there on the line. If you don't like what I'm doing in terms of, how I feel about the world, that's fine. Just like I can't tell you if you're telling people don't get it. I mean, that's your right to do so. But at least be man or woman enough to let us know who you are. Right. I mean, why hide? So you have something to hide. So I mean, that's that issue. Thirdly, to me personally, I stand behind what I believe in and what I'm doing. And again, my sole and only purpose is try to help people stay alive. And that's it. Mm-hmm. I have no other concerns or worry other than what I can do to help my fellow man. That's my Christian belief. That's my personal belief, and I will always do that regardless. But that's why I say, listen, sign your name to it, and let us know how you feel. I'm more than happy to have a conversation with you, and we can choose to debate points. I have no problems with that, but at least let us know who you are, and don't sign it from some address that's not even yours. I mean,
Exactly.
Again, but I tell you one thing, I will say one thing I can honestly say. I must be making an impact if you took the time to try to send me a letter. That must mean what I'm doing is making an impact. And that's really was my goal, is to impact people positively, not negatively, but positively.
Keith, I was reading an article about the whole idea of Americans in particular not really understanding or being affected until now, and of a public health issue of this magnitude, and that they don't understand, and that the public health officials have not connected the dots enough to let people understand, why things are happening. So you go from, okay, you can take your mask off. Oh, whoop, nope, wait a minute, got to put your mask back on. Wait, no, we need a third shot. Oh, wait, et cetera.
I know.
Can you just talk about the whole public health thing in terms of because basically we're watching the science happen as it's happening.
Yeah. Well, I tell people this. Understand this piece. Think about COVID-19 has only been around for, a year and a half?
Mm-hmm.
I mean, some people expect everybody to know everything immediately. But think about it, when you get exposed to something, like say somebody tries to teach you how to fix a car, you're going to know every aspect of that car. Time somebody hears your car, fix it. You may be a mechanic, but if it was a car that you've not seen before, there are going to be things you have to learn. The only thing I fault and I understand, though, the piece about trust or lack thereof. The government has not always been the most trustworthy organization we've seen. So I have no issue with understanding that point. Mm-hmm. But you have a lot of us who are not in the government who are also a part, and you see it every day across the street. The thing I fault this whole process is I think the way I craft things and I say things like this, I'm like, what we know right now is X. Yeah. What we may learn in the future may be Y. So the things we say now may be impacted by the things we see later. So you have to be careful on how you craft what you say, and that's where I think they failed personally. Mm-hmm. Is you have to say, when I don't know something or feel strongly about something, I'm very careful with my words, and you'll see things I feel strongly about. And you know me well, Barbara. I'm going to spell it out like it is. I'm going to tell it. But I do that based on facts, and I do that not based on fiction. So I think what I really would caution the public health world to do is to just craft it so that you're saying, based on what we know today, based on these are the recommendations. Yeah. Now, that may change as we unfold and learn more. But the mask on, mask off, personally, I never did any of that. I hadn't been anywhere without my mask going outside other than when I'm walking across the street, and I don't even take it off until I'm in the street. Yeah, when I come out this building and I've walked 100 feet, then the mask would come off until I get close to Norfolk General Hospital, and it goes right back on again. Yeah. So and that's been the way I've been from day one. I'm
actually, the mask wearing, hand washing, staying reasonably socially distant, are also good for all the other things that we catch anyway: flu, colds, all of it. So the practice really makes sense. We got about 5 minutes left, and somebody on Facebook wanted to know: does the virus impact children differently? So, in other words, does it attack children's bodies differently than adults? That
we don't really know. The one thing with kids is kids are resilient. They're going to recover a lot faster than we will, as we get a little older. So I'm not sure there's as much that it affects them different as the resiliency of their bodies, because they're so young and growing, and their immune system is probably so strong. They may be able to fight it a little bit better than we can as we get a little older. But the issue is just, why take the risk? losing a child is something I would never want to experience, ever, ever, ever. I mean, I remember when my father died, and I remember I was only 7 years old when my father died, and I remember being at that wake, and I remember everybody crying, but I remember just like it was yesterday when I saw my grandmother or my father's mother walk in that room and see him, she lost it. And I didn't understand then why she lost it more than everybody else until I became a parent.
Yeah.
And then all of a sudden I'm like, I understand it now much better than I did then. So the thing is, do you want to risk that potential? Especially a non-healthcare worker. I mean, I'm trying to get them to understand you're not even in healthcare, but you act like you know everything already. Yeah, I mean, just be careful with that and how that may impact somebody else negatively.
So here's another question from Facebook. 3 minutes left. What's the best thing we can say to try and convince unvaccinated loved ones to get the shot?
That's a good question, because I think the first thing is understand why they're so hesitant. And once you can find why they're so hesitant, it's going to be a little easier. But sometimes what you want to do is play on people's empathy, because you just ask yourself, suppose you affect somebody, suppose you affect your mother, your brother, your wife, your kids, something happens to them. I mean, sometimes you have to implore people to get them out of their own selfishness and look at what they do, how it may impact somebody else. This is not like kidney disease. If you need to go on dialysis and you choose not to do it, the only person that's going to be affected is you, other than the emotional aspect of your family. But they're not going to get kidney disease because you don't get dialysis. This is different. This can be easily transmissible and can end somebody else's life. So that's the part I want to get people to understand. Hit them from that empathetic aspect. That's the best thing I could tell you. And if they don't care after that, I don't know what to tell you. I mean, I don't know what to tell you past that. But that's what I would recommend.
And when people go for their booster shots, they should go back and get the same shot that they got before.
When I was listening to that, this is what they said, which seems kind of silly to me. They said that if you get a Pfizer, you should get a Pfizer. If you get a Moderna, you should get a Moderna. However, they said if you don't know what you had the first time, you can get the other the other shot. I'm like, what difference do it make? And I understand why. They're just trying to keep, because of the data. The data is clear about Moderna. The data is clear about Pfizer. But in its own, they didn't do a bunch of studies mismatching the two. Right. So I think that's why they're just making the recommendation based on the data. But you can, if you don't know what the first one was, you end up getting the second with the opposite company. I mean, they say that's still acceptable.
Okay. Dr. Keith Newby, he is a cardiologist, and he is also the Director of Health Equity for Centera, and he'll be back with us again next month. And Keith, hopefully we can move on to some other health issues. But you know what? I am so passionate about this because I think that I really want to try to do as much as we can to try to save lives, because I think it's that important.
Well, it's just all I seem to talk about now. And I know people are sick of hearing it from me. And I'm like, well, then get your shot, and then we won't have to talk about it anymore.
Exactly. Thanks so much, Keith. We appreciate it.
Anytime.
We'll talk to you soon.
I look forward to it.
Okay, take care.
All right.
So optometrists across Hampton Roads are very concerned about the toll remote learning and mask wearing is taking on our children's eyes. Our Lisa Godley spoke to optometrist Dr. Christina Ramsey about the problems she's seeing in her younger clients and what we can do to ward off long-term damage.
The virus has impacted all of us in terms of how we do things and what we do. So the children, they're spending a lot of time in front of the screens, and their whole school year pretty much was in front of a laptop or a computer screen or on a phone or something to that effect. So what impact is that having on their eyes?
Well, what I've seen directly in my practice is that kids who were going to be nearsighted because of genetics or anything in their family, they're progressing a lot more quickly into the more serious nearsightedness. Thicker lenses, a little bit more dry eye. The kids who didn't really need any glasses, and I didn't expect them to have any glasses later on, are finding that they're needing help because all they're doing is staring right there at that screen all day long. Whereas before, at least they would get up, run around, talk to people at greater than that laptop distance.
Right. So is there anything at all that can be done about that?
Absolutely, and it would be great. I need to talk to the teachers too. Every 20 minutes, we like to call this visual hygiene. Every 20 minutes, everybody needs to look up away from the screen for 20 seconds, at least 20 feet away. So we call that the 20-20-20 rule. Okay, so every 20 minutes, 20 seconds away, at least 20 feet, and that would help.
Wow, that's interesting. I can use that myself, actually.
Right, you set a little timer. And the other thing is, if they start having problems like burning of their eyes, we need to look at the ergonomics of their screen. So the screen should be a little bit lower than your eye level, because if you raise it up too high, you don't blink as often. And so we need that blink in order to keep our eyes nice and lubricated. So setting the screen a little bit lower than what their eye level is would be great.
Wonderful. Now, I also read the masks are causing dry eye.
Yes, it is. Yeah, a mask-associated dry eye. And that's all because we're not getting the recirculation of the air. So we need to start putting in drops if you're having problems like stinging, burning, like something is in your eye. And, sometimes over-the-counter drops will be fine, as long as it's not Visine or Clear Eyes. But anything else would be wonderful.
Wow. So much to learn, so much to do. How else has the virus and what we've been dealing with for the past year and a half or longer impacted your patients? What have you seen?
Mainly it's just dryness. And if they were dry before COVID, they're even more dry now. And so we've had to upgrade from over-the-counter drops to prescription drops like Restasis or Xiidra. The other thing is that their eyes are getting tired from staring at the computer for 8 hours a day, whereas before they could at least, move around a little bit. And then there's, some people who are just, their eyes, they have a little bit of debris on their eyelashes, and so that causes them to touch their eyes a little bit more often. And so we've got to learn to not touch our eyes with our hands right now.
Okay. So any of these things we need to immediately see an optometrist if we're noticing something, or will the eye drops do? What are your thoughts?
I would say you can go ahead and get the drops over the counter, and if you're doing those drops more than 2 times a day and it's not really relieving any of your problems and you're having burning or stinging or even red eyes, then I would definitely call an optometrist and make an appointment, because there's other ways we can treat that without you struggling and being in pain.
Gotcha. Okay. Is there anything that I haven't asked that you think people should know regarding the virus in their eyes?
There was some talk about the virus can live in the tear film, and there is truth to that. But as long as you keep your hands washed and don't touch your face, then we should be fine.
Okay. Dr. Christina Ramsey, thank you so much for your time today. I really
no
appreciate
problem.
it.
Thank you. I appreciate it.
Okay. Bye-bye.
So as we get ready and we go back to school, our kids going back to school, I will tell you my granddaughter is now wearing glasses, and her optometrist told her the same thing, that 20-20-20 rule. And I think all of us could learn from that 20-20-20 rule to make sure that you give your eyes a break, because staring at the screen is just not good for us. So this Delta variant of the coronavirus is so serious, and it's up to all of us to do our part to stop the spread. If you know someone who needs correct information, share this show with them. You can find this podcast and all of our Another View shows at anotherviewradio.org. And please, if you haven't gotten your first or second shots, please make it a priority and get vaccinated. And if your excuse was waiting for full FDA approval, well, now you've got it with the Pfizer vaccine. Get the shot. And if you don't want to do it for yourself, then do it for someone you love. Let's all work together to stop the spread of this deadly virus. And as I told you at the top of the show, there are several places that you can get your shot for free, including the Community Connect, which is happening this Saturday, August the 28th from noon until 5 p.m. It is located in Norfolk in Ward 3 at 2600 East Princess Anne Road in Norfolk. Bring the kids out, wear your mask, and come on out and have a good time. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer, and our intern, Lang Burgess, answered our phones. Today is Lang's last day. Congratulations, Lang. Have a great school year. We love you. I'm Barbara Ham Lee. Stay safe, be well, and join us again next Thursday at noon for Another View.
Support comes from Thomas Nelson Community College. Whether you want to start your bachelor's degree or advance your career through a short-term program, the first choice is Thomas Nelson Community College. More at tncc.edu/firstchoice.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever. Whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.